A fine day boded well for the first National Transplant Week Forum, kindly hosted by the Department of Health in South East London, who were keen to stress their collaborative intentions.
We know in the Department of Health there's some things that charities can do much better than we ever could. So we think that we should let people who can do the job best do the job, and we will support them to do that. So that's why we've been delighted to host the meeting today, to bring together various people from across the sector, from everything to do with organ donation and transplantation right through to the people helping transplant patients after their transplant. And in this way we can help kind of fertilise the ideas and bring people together, particularly in the run-up to National Transplant Week. There's an awful lot of work going on to improve organ donation and transplantation, and this is a great chance for people to shout about that.
Delegates from all manner of transplant-related charities came together for a day of presentations and discussions. It was a chance to showcase their work and reach a wider audience, a time to learn about each other's activities and to consider how best to coordinate everyone's approach to National Transplant Week for maximum exposure and best effect.
We're all here to try and achieve more transplants for more people, more donors and better care of donor families in particular. So everybody here shares the same aim. Everybody comes from slightly different backgrounds. Everybody tries to look at that problem in slightly different ways. But I think there's a huge strength from getting people together to work out where we can work more effectively by working together, but also where some groups with some particular areas should do it themselves.
Collaborative working wasn't just for the future, it featured within the day itself, as breakout sessions gave participants the chance to network and swap ideas, to scribble feverishly on large sheets of paper, and eventually to present the results of their deliberations to the group.
Everybody can contribute to.
Putting their hard work into perspective from the real world, delegates heard from Alexander Holt. He had a kidney transplant after total renal failure, the organ donated by his father.
The access to the patients is a struggle, and I know that because nobody accessed me. Nobody managed to come and say, we'd like to support you here, or we'd like to do that for you.
But it wasn't just the needs of patients that were highlighted. Families and carers too had representation.
They don't expect to have to give up work to do it. They don't expect the health to really suffer on occasions because the right support isn't there. They don't expect to end up in poverty, and these are all things which we can change. But also we do need some change from the central government as well, but information and advice can at least get you part of the way to make sure you can get what's out there.
And it was a day for each charity to shout about what they need help with.
Our colleagues from Northern Ireland obviously have come with a slightly different agenda because they do feel quite marginalised over there. And one of the things that we've said that we'd like to do is actually take an event like this over to Northern Ireland and to try and get some buy-in from the Northern Ireland Assembly to increase the number of transplants that take place in the province, because at the moment it's I think 19% and in this country it's about 33%. So there's a bit of a gap there. It'd be nice if we could close that.
Questions from the floor came aplenty, with lively discussion and contributions from charities such as the Transplant Support Network and the British Kidney Patient Association, amongst many others. The verdict, a great success, and one that could and probably will be repeated.
I think that we should have at least one of these events a year where we come together collaboratively and work with the other charities to discuss National Transplant Week. And perhaps what we should work towards is having a consortium of charities that sign up officially to take part in National Transplant Week. Then I think we will really have made a great achievement.
We must engage with the public, we must talk to the public, and we need their help. We need their help by putting their name on the organ donor register, by supporting organ donation, and that's where the people in this room can play such a huge part.